When Troy Bannister pursued his interest in being an EMT, he found out that it's extremely difficult to access all of our healthcare data in the U.S. Our antiquated healthcare system still uses fax machines as the primary means of communicating health records.
For me, that was a really interesting thing because I wanted to understand why. Why couldn't it happen? Is it a technical problem? Is it an economic problem? Is it a legal issue? What is it? And so that got me really interested in the problem space. If you're providing care to a patient and you're responsible for that patient and you don't have their medical records, you're at a disadvantage. And having their medical records clearly at your fingertips can help you prescribe safer meds or understand that this patient might have diabetes. And so you can use this data to improve the outcomes of your patients, whereas the groups that don't have access to the data can't. My name is Troy Bannister. I started a company called Particle Health, and I'm the founder and CEO.
He traded the ambulance for a business plan. Now, Troy is committed to creating an elegant API platform to get people fast, easy healthcare data. Finally. What is Particle Health and what inspired it?
It's an API that connects to all the practices, hospitals, clinics, labs, and now increasingly digital health companies, and shares data across all of them. And it's directed either by providers or consumers or whoever's using that tool that we plug into. So one of the first things I did when I got to college was sign up for the EMT class. And at the time I was in business school, and on the weekends and on the summers I was working in an ambulance. And I absolutely fell in love with medicine when I was doing that. And so I ended up switching to pre-med, going to med school. At med school, I relatively quickly realized it was not for me, which is a very hard decision to make at that point in the path. But I switched out and got a master's degree in biophysics and physiology. Took that, did clinical research for a few years in New York, and somehow got pulled into the digital health world. They were doing some really simple stuff like text message reminders to take your medications, and they were proving like 20% of people don't go to the ER if you are reminded to take your meds on time. And I was like, this is a big deal. Nobody's using the internet or cell phones for healthcare. And so I joined a small venture firm out here in New York and got really involved in the digital health startup ecosystem. And when I looked back on my whole career, I just saw this consistent issue where no matter where I was, in the ambulance, the hospital, doing research or working with entrepreneurs, nobody had access to clinical data. The best option was the fax machine, and still is, funny enough, today. And so I saw this really clear issue no matter where I was, and the issue spanned the entire, healthcare ecosystem. And I thought this is a problem worth solving. And so I jumped in and put my boots to the ground and started going.
Are there any growing pains you've experienced as a co-founder of Particle Health?
This is like such a general term, but the operational scale issues, once you get to like 15, 20 people and you start adding a new person, the complexity of communication gets exponentially more difficult, right? It's not just one more person, it's one more person connected to the other 15 people. So it's like 15 more lines of communication. And so every time you add another person, if you don't have a system in place to facilitate that communication, it starts to get a little bit crazy. Figuring out how do we communicate, how do we set goals together, how do we keep each other up to speed on what's happening. So that's one big, category. I think the second category is how do I start building my organizational structure in a way that doesn't start to impede on itself. In the beginning, we had our engineering team divided by front-end engineers, back-end engineers, and data engineers. And we had like 3, 4, or 5 people in each, and that was great. Now we're like, we need to change that. We can't have all the same engineers in a group working together. We need to split them up, and we have to have multidisciplinary teams focused on mandates. So in those worlds, we need to take one person from the back end, one person from the front end, and one person from the data team and put them on a team. Instead of just forgetting about this and loading these teams up with more people, let's design this in a way that is self-serving in the future so that we're not having to do this at a point in time that's going to be destructive. And so it's kind of like seeing around the corners. What are we going to need, and how do we design that now so that we're not in the doghouse later and have a ton of technical debt to solve for? So I think those are the two big ones, is the communication operational stuff and the system thinking of the future.
Troy makes a really good point here about thinking ahead. On one hand, it's great to get a working prototype out to make sure your idea is solid. On the other hand, you don't want good enough to be your baseline. There's a balance to be had, and in order to keep that, there needs to be consistent improvement as you keep moving forward. As long as you do that, you'll keep your momentum and see all the possibilities for your business. Do you have any advice to offer other entrepreneurs?
If you think about the mindset is like the platform on which you're making decisions. You have to maintain that in a good place. You have to wake up, and no matter how bad your day is going, you got to get those thoughts out and make those good decisions. You can't just let those bad feelings dictate what you're doing. I think we used to joke around about the existential threat of the week. The one customer you have giving you the email that says, we're unplugging and we're going to stop paying you next week, right? That will happen. And if you sit there and let that get to you, you're going to fail. If you can take a 30-minute breather and go on a walk and come back and say, whatever, it doesn't matter. We're going to try to get them back. But if not, there's more customers in the pipeline that we can get that are bigger and better. You're going to make better decisions. So I think that's the foundational philosophy behind entrepreneurship, is the thoughts that you're having and how those impact your decisions. It becomes who you are. And there is that line disappears between you as the founder of the company and you as an individual in the world. And that's a hard thing, emotionally and psychologically to constantly be dealing with. Like the other things, you have to build a muscle to learn how to turn it off. It's really, really important to figure out how to do that. You'll never be able to get it all off your table, and nor should you, but you have to figure out how to be able to turn it off sometimes. And if you don't, it's not fun. And it should be fun. It has to be fun.